students, welcome to our course. Let's start with our lesson number 2nd. The topic is Introduction of Solid Dosage Form. In this lesson, we will learn about the solid dosage form, classification of solid dosage form, types of solid dosage form available in market, from which we will briefly study about the powders, advantages of powders and their use. So, without any delay, come to the chapter number 2nd, solid dosage form.
So now, dear students, come with the lesson number 2nd, solid dosage form, in which we will discuss about the solid dosage form powders. So powders are the mixture of finely divided drugs or chemicals in dry form, or we can say a pharmaceutical powder is a mixture of finely divided drugs or chemicals in dry form. These are solid dosage form of medicament which are meant for internal or external use. Particle size of powders plays an important role in physical, chemical and biological properties of dosage form. There is a relationship between particle size of powder and dissolution, absorption and therapeutic efficacy of drug. So we can say when we reduce the particle size of powder or particle size of any medicament, so dissolution rate of that medicament is increases, as well as absorption also increases, and the onset of action of that medicament going to increase. So powder are those dosage form which are finely divided dosage form in which one drug or more than one drug medicament are mixed in finely divided form in dry form. So now come into the advantages of powders. Powders are more stable than liquid dosage form. So in liquid dosage form, we generally use water as a solvent, which is good media for microbial growth. In powder, there is not any solvent use. So powder are dry dosage form, that's why more stable than liquid dosage form. Second one, the chances of incompatibility are less as compared to liquid dosage form. Third, the onset of action of powder drug is rapid as compared to other solid dosage form. In capsule, tablets or other solid dosage form, formulation at first disintegrate, then dissolve and absorb. But in powder dosage form, disintegration step is skipped. So time consuming in disintegration is not involved. So onset of action is rapid. Secondly, due to the smaller particle size of powder, it get dissolved readily in the body fluid. So onset of action of powder drug is more rapid to other solid dosage form. Third one is large quantity of powder drug can be administered to the patient orally by dissolving or mixing in the powder in suitable liquid. So large quantity of powder like tablespoon is easily taken by dissolving in milk or water, so easily acceptable by kids and old patients do those face problem to swallow other solid dosage form like tablet and capsules. Next is powders are more economical as compared with other solid dosage form because not required any special machinery or techniques, or you can say in other dosage form we use more excipients like vehicles, bulking agent, disintegrating agent, granulating agent, flowing agent, or you can say excipients, which is totally skipped in powder dosage form. So the total making cost is less than other dosage form. So powder dosage form are more economical as other one. Next is powders are easy to carry anywhere because no chances of leakage, and less space consuming. So these are the advantages of powder or powder dosage form. Now disadvantages of powder dosage form. During drugs having bitter, nauseous and unpleasant taste cannot be dispensed in powder dosage form. Delicate and hydroscopic drugs cannot be dispensed in powder dosage form. Some drugs which absorb moisture from environment and get sticky or lost its potency, these drugs are not suitable to give in powder dosage form. Now come to the classification of powders. Powder are classified into 5 types: bulk powder for internal use, bulk powder for external use, simple and compound powder for internal use, powder enclosed in catches and capsules, and compressed powder. At first, we will discuss bulk powder. So, these powders are dispensed in bulk form because quantity or accuracy of doses not important here, like powder used for surgery and wounds. Powders contain several doses in one box or one packaging and generally supplied in wide-mouthed or easy to removal type of container. These are used for non-potent substances like laxative and purgative. Example, this is like rhubarb powders, or you can say uh, last purgative, pet safa, etc. Now come to the first classification, bulk powder for external use. These powder are used externally for their therapeutic effect and generally supplied in perforated cap container for easy application. Types of bulk powders used externally are divided into many types. Number 1, dusting powders, insufflations, dental powders, snuff and Dosage powders. Now come to the first type of powder, dusting powder. These are finely divided powder without any gritty particles which is passed through sieve number 80 to 120 to avoid irritation if used topically and to increase effectiveness. They are of two types, medical and surgical. Both of dusting powders must be free from pathogens so that sterile by dry heat sterilization or dry heat method in hot air oven at 160 degrees Celsius for 2 hours. Surgical powders generally used internally. In the preparation of dusting powder, talc or kaolin starch are commonly used because they are chemically inert. But these ingredients having the tendency to easily contaminated with pathogens or bacteria or easily contaminated or easily available for the growth for microbials, so they must be sterile before use. Generally, we use dry heat sterilization, or the best method for dry heat sterilization is hot air oven. The dusting powders are dispensed in cipher or aerosols containers and generally they are non-toxic but they are fine in nature. So inhalation these fine particles by kids or infants may lead pulmonary inflammation. So the proper indication are labeled in these dosage form like keep away from children so that these type of harmful effect not cause. Generally antiseptic, astringent and absorbents and antiperspirant medicaments are delivered through these type of bulk powder dosage form, or you can say dusting powder dosage form. Now next classification of bulk powder is snuffs, insufflations. Insufflations are a class of powders meant for application to body cavities like ear, nose, vagina, etc. The powder has to be extremely fine and must find an entry to cavity deep enough to bring about its action at the site. It is delivered to the affected part in a stream with the help of device called insufflators, which blow the powder to the site. Some of the insufflations contain volatile liquids ingredient which may require uniform distribution in the powder. Active volatile liquids present in the small portion should not be removed by evaporation but only incorporated by titration in the powder. The pharmaceutical industry packaging the insufflation is pasteurized form like aerosols. Aerosols contain the medicament in a stout container with a suitable valve and the delivery of powder being accomplished by the liquefied or compressed gas propellant of a very low boiling point. On pressing the actuator of the valve, the propellant delivers the medicament in the stream. So, insufflations are used to produce a local effect in the treatment of ear, nose, throat infection with antibiotics or to produce systemic effect from a drug that is destroyed in the gut. Now, bulk powder for external use, snuffs. These are finely divided solid dosage form of medicament dispensed in flat metal box with hinge lid. These powders are inhaled in the nostril for decongestion, antiseptic and bronchodilator action. There is a difference between insufflation and snuff is snuffs only used for nasal cavity whereas insufflation is used for body cavities included nose. So for snuffs, there are special containers as shown in figure are used. Next, dentifrices or we can say dental powders. These powders are meant for cleaning the teeth. Dental powders contain detergent, abrasives, antiseptics and coloring and flavoring agents incorporated in a suitable base. Generally, the base is calcium carbonate. The detergent is in the form of soap and finely powdered pumic stone provides abrasive action. Essential oils, if present in small quantity, are easily absorbed by calcium carbonate and pumice. This makes the uniform distribution of oil difficult. So, here we given an example of dentifrices or you can say dental powder. Here we use hard soap powder for foaming purpose, calcium carbonate powder which is used as a abrasive agent, saccharine as a sweetening agent, peppermint oil as a flavoring agent, cinnamon oil. Here we use cinnamon oil have two effect as a flavoring agent and also as a mild antiseptic action, and methyl salicylate used as a preservatives. So bulk powder for external use in which include the dentifrices or dental powder, they are only used to clean the teeth. Now simple and compound powder. In this form of powder, each individual dose is enclosed in paper. These are unit dose powders normally packed in properly folded papers and dispensed in envelopes, metal foils, small heated plastic bags or other container. Usually for the preparation of simple powders, the ingredients are weighed accurately and blended by geometrical mixing in ascending order. These mixture is then either delivered in the blocks of equal size and number of blocks representing the number of powder to be dispensed. If we dispense or if we use only single ingredient to prepare a powder, this type of powder is called simple powder. While we if we use more than one ingredient to make a powder, this type of powder is called compound powder. The minimum quantity of each powder should be less than 100 mg, for it can be handled conveniently by the patient and can be weighed accurately. Simple and compound powder. At first come to the simple powder. In simple powders contain only one ingredient, either in crystalline or its amorphous form. If powder present in crystalline form, then it is reduced to its fine powder. Weight the powder and divided into number of doses and wrapped in the individual dose. Here is an example of simple powder: aspirin 300. So aspirin is generally found in its crystalline form. When we will dispense this type of powder where simple only one ingredient is used, as we can see here, only aspirin is here. Okay, so this is simple powder. Only one ingredient is used here. So aspirin is generally available in its crystalline form. When we dispense aspirin in a powder form, firstly we will weigh the accurate quantity of aspirin, like here mention is 300 mg. Okay? Then we titrate it in a motor pistol if we are performing in lab. Then after dividing into the powder dosage form, we will a dispense or wrapped in a suitable wrapper or powder paper. Or we can mention in the label one powder to be taken every 8 hours. So this is a simple powder. Now compound powders. Compound powders contains two or more than two substances which are mixed together in dry form, then divided into desired number of individual doses, then dispensed into each powder paper. So here is the example of same aspirin. ठीक? Aspirin 300 mg. But with aspirin, we are using paracetamol and caffeine here. So there are three ingredients which are used to make powder dosage form. That's why these are compound powders. So here we take all three ingredients in a mortar pestle and titrate until it form a fine powder, and then dispense in individual wrapper paper or in a bulk form in a container. Next, powders enclosed in catches and capsules. Catches are solid dosage form of drug, and catches are also called wafer capsules. These are molded form of rice flour. Rice paper prepared from mixture of rice flour with water enclosed in between two hot polished cylinders. Then was evaporated and vapor is formed. In the catches, 0.2 to 1.5 gram nausea or disagreeable drug is powdered form are enclosed. So catches are unit doses form was very popular some time back. Presently, catches are seldom used and have been replaced by capsules. Catches like capsules can be easily filled and sealed at the dispensing counter. These dosage form hold larger quantity of medicament as compared to capsules. Since the catches are made of flour and water, they are easily damaged in handling. That's why these dosage form replaced by capsule dosage form, or due to the size and shape of catches which is difficult to swallow. These are now not used and properly replaced by capsule dosage form. So here are the advantages of catches. They are made easily, disintegrate quickly and dispense easily. But there are some disadvantages of catches on capsule. They require soften before use or swallow, or you can say they are difficult to swallow, easily damaged as these are the wafer of rice flour, cannot be protect the enclosed duct from light and moisture. Cell of the catches are fragile, so drug content cannot be compressed. They are not suitable for the filling the drug in large scales, and they occur more space compared with tablets and capsule. That's why we are saying that's why catches are not used nowadays. They are properly or completely replaced by the capsule dosage form. Now here we discuss some problem which involve when we prepare or when dispensing of powder dosage form. At first, volatile substances. As name indicate, volatile substances are substances which are vaporized or volatile in nature. So, so when we have to prepare powder dosage form which contain volatile oil, so to prevent the loss of volatile oil, we these vegetable drugs must be powdered lightly in mortar pestle. Also, menthol, camphor, and essential oil take place incorporation in powder dosage form. And final product pack with double wrapping. Please notice that double wrapping, because these are volatile substances, so they are wrapped in double wrapping. Next, dispensing of powders involve special problems. Second one in hygroscopic and delinquent substances. Hygroscopic substances are those substances when we exposed to environment absorb the moisture from the environment, and deliquescence is the process by which a substances absorb moisture from the atmosphere until it dissolve in the absorbed water and form a solution. Deliquescence occur when the vapor pressure of solution that is formed is less than the partial pressure of water vapor in the air. But certain powders absorb moisture to such a great extent that they become watery and are called deliquescent powders. Example of such substances include ammonium chloride, iron, ammonium citrate. Such substances are usually supplied in granular form in order to expose less surface area to the atmosphere. These powders should not be finely powdered. Such powders should be double wrapped in humid weather, or when dealing with very deliquescent substances, further wrapping in aluminum foil or plastic cover is advisable. So, if our medicament is hygroscopic and deliquescent in nature, firstly, we not titrated in finely divided powder dosage form. We generally use its granular form to avoid expose or to order to expose less surface area. Secondly, we wrap the medicament or powder dosage form in double wrapper packing, or if we required, we further wrap it into the aluminum or plastic cover if advisable. Next, efflorescent powder. An efflorescent substance is the chemical which has water associated with its molecules. When exposed to air, lose this water through evaporation. Or some crystalline substances liberates water of crystallization wholly or partly on exposure to the humid atmosphere. Examples are citric acid, caffeine, and ferrous sulfate. So, solids that behave in this way are those with water of crystallization. The molecules of water of crystallizations are partially or completely lost of an atmosphere, thereby making them lose their crystallization form. If so, this problem overcome by mixing or incorporating with inert substances or using anhydrous salt. Next, eutectic mixture. When two or more substances are mixed together, they liquefy due to formation of a new compound which has a lower melting point than room temperature. Such substances are called eutectic substances. Examples: such substances include menthol, thymol, camphor, phenol, etc. These substances can be dispensed by two methods: dispense a separate set of powder with direction that one set of each kind shall be taken as a dosage. Second, an equal amount of any of inert absorbent like magnesium carbonate, light magnesium oxide, kaolin, etc. may be mixed with eutectic substances and then blended together lightly with a spatula or a sheet of paper. When in addition to liquefying substances, other ingredients are also present, the liquefiable substances should first be titrated together to form a eutectic mixture. Then remaining ingredient of prescription are incorporated and mixed together. So, in this case, if liquid quantity is small, it may be titrated with the equal amount of powder. Then reset of ingredients are incorporated in a small proportion with continuous stirring. Next, potent drug. Potent drugs are substances having a maximum dose of less than 60 mg and they are poisonous in nature. If we increase the quantity of these drug or dose, these may cause toxic effect or harmful effect. It should be difficult to weigh on dispensing balance because the quantity of these drug is very small. For that, firstly, potent drug incorporated with the diluent such as lactose before weighing. So, example, codeine phosphate. In this case, firstly, we have to weigh 10 mg of codeine phosphate. So, we weigh 10 mg of codeine phosphate and 900 mg of lactose in ascending order with the help of spatula. Out of 1 gram of titrate, weigh 100 mg of powder contain 10 mg of codeine phosphate. So, if potent drugs are drugs or chemical substances having maximum doses of less than 60 mg, or if we increase the dose, they may produce toxic or harmful effect, or they may cause poisonous action. So these doses form or this minimum quantity is very difficult to weigh. So we can weigh these type of substances with including or with incorporating the diluents to increase the bulk. Thank you. This was our lesson number second, in which we learnt about solid dosage form, powder dosage form, types of powder dosage form, and problem associated with powder dosage form. Thank you.
So today we understand about how solid dosage form are classified and what are powders, its advantage, disadvantages, and hope you all get it well. So for today it's enough. Enjoy your day and keep learning. Soon we will come with chapter number 3, which is pharmaceutical dosage form tablets. Till then, take care. Bye. Thank you.